I just ask that you do your best. No one's ever got 100, okay?
With that mindset, I walked in,
Some of these tests are fun,
sat down,
some of them are challenging.
and prepared for a mental marathon.
When the voice stops, I want you to repeat as many words as you can remember. You're going to draw a continuous line, alternating from number to letter in order. Earlier, I told you 3 names of things. Can you recall what those were?
It was an hour-packed session of brain games.
That's right.
It's my first step in a year-long study with the Women's Alzheimer's Movement Prevention Center at the Cleveland Clinic LaRuvo Center for Brain Health.
Twice as many women have Alzheimer's as compared to men.
A statistic underscoring the importance of studies like this one. The focus, women between the ages of 30 to 60.
What's fantastic about this prevention center is it says, we want to get you when you're young, when you're healthy, and when you can make a difference.
That's journalist and former First Lady of California, Maria Shriver. She founded the Women's Alzheimer's Movement, or WAM, now part of the LaRuvo Center.
There are women from all across this country and all across the world who want to improve their brains, who might be scared of Alzheimer's, who might have some dementia in their family. They've seen this disease up close, and they don't want to get it.
We know now that up to 40% of current cases could have been prevented if we knew then what we know now.
Which is why I'm here. On my mom's side, my aunt and grandfather suffered from dementia. On my father's side, my grandmother, great-uncle, and great-grandfather had some form of dementia or Alzheimer's.
As a woman, I'm already twice as likely to develop Alzheimer's. I'm also Black. We're also twice as likely to develop Alzheimer's compared to white, non-Hispanics. But the data also points to other factors, especially when it comes to people of color.
Some of those things are higher rates of diabetes, higher rates of high blood pressure, and those things are risk factors for Alzheimer's disease.
But it's not just health conditions. Access to equitable health care, nutritious food, and late diagnoses all contribute to increased risk. But it's challenging to explore the risk without the research.
So what you want when you're running a study is what they call generalizability. So when you get a finding, you want to be able to say that this is relevant to the world. But unfortunately, most of them include primarily white individuals, white non-Hispanic individuals. Research studies have to do better, including ours, at getting people into the study, allowing access to the study, bringing awareness about these studies to people who aren't white.